So thank you, Sarah, and welcome everyone. It's my pleasure to introduce our speaker, Françoise Mathieu. Françoise is a specialist in high-stress workplaces and is with us today to share practical advice on how to combat compassion fatigue and burnout. So Françoise is the founder of Compassion Fatigue Solutions and co-executive director of TEND. She's a sought-after speaker and educator in Canada, the US, and around the world. And since 2001, she's given hundreds of seminars on compassion, fatigue, and self-care to tens of thousands of helping professionals. So we're very pleased to have Françoise with us today and very much looking forward to her presentation. Thank you for joining us, Françoise. Over to you.
My pleasure. So first of all, can you hear me okay?
Yeah, sounds great.
Wonderful. Okay, well, greetings to all of you. I heard that there were quite a few people on the webinar today, so that's wonderful. And this is obviously a larger topic, and what we're going to do today is hopefully do an overview of where the field is at, kind of where is the research at in terms of compassion fatigue, secondary trauma. And what I'm also going to do is I'm going to provide additional resources for folks who are interested in this. Just wanted to also let you all know that I've emailed just now Lorraine the slide deck. If anyone's interested in having a PDF version of it, it will be available, well, it's available immediately after the call. So I want to kind of give a little bit of background, first of all, before I keep going. It's kind of who am I and why am I doing this stuff? So you'll probably see from the first slide that I have a master's in counseling psychology. I'm a registered psychotherapist, which is a professional designation that was recently created, although many of us have been in the field of mental health for a very long time. But about a couple of years ago, we became a registered health profession. And we do very similar work to folks who have a master's in social work, which might be something that some of you have as well. I'm based in Kingston, and I've been there for over 22 years. And my original kind of home was in northern Quebec. I was born in the high Arctic. My parents were teachers up there, and we were originally also from Montreal. In the past, I have worked with a variety of groups who work with refugees and immigrants of various stripes. I have worked with the Refugee Protection Division of the IRB. I had a 3-year contract doing a variety of consulting with their decision makers who, as I'm sure you're well aware and have experienced perhaps, were demonstrating quite a lot of stress effects of their own. And I've also worked with the UNHCR and a variety of grassroots not-for-profits across the province who work with refugees in various capacities across the board. I also work with a whole bunch of helping professionals from law enforcement to social services to the criminal justice system. The list goes on and on. And I became really interested in the topic of compassion fatigue and burnout as a clinician myself. So I was working in a variety of positions with the military. I was also working at Queen's University as a crisis worker. And I was starting to notice that I was experiencing some stress effects for sure. But because I've been in the field for over 20 years now, primarily doing crisis and trauma intervention, in the late 90s, there was really not a lot of education in the counseling psychology field on concepts related to burnout and really anything related to trauma, which is kind of surprising. I mean, nowadays you kind of think, how could you be a crisis worker and not have any trauma background? But that's kind of the way it was. And I'll explain in a few minutes why that was. But really the short version is historically, as you probably know, we didn't start looking at post-traumatic stress disorder, for example, until the 80s. And it wasn't really until about 1995 to 2000 that we started looking at what is the impact on service providers. And I'll talk more about that a little bit later. Why did I actually start this process? So as I've mentioned before, I've been a mental health professional for over 20 years, and I love my work. I love working with people who are in distress. I love offering resources to them. I love providing compassionate care. And what I started noticing, which I'm sure you have if you're a frontline worker, is that my most vulnerable folks were often, quite frankly, being re-victimized by the system. So maybe I would take a suicidal young person to the hospital emergency ward, and sometimes the triage nurse was amazing, and sometimes they absolutely were terrible. And I saw people being profiled. I saw people being discriminated against. And I also saw certainly elements of burnout among law enforcement professionals. And these were really good people. These were not, terrible, corrupt police officers. These were wonderful domestic violence sexual assault response units. These are people who are chosen to work in a, pretty humane version or branch of policing. And I was noticing that they were losing their compassion. And I started kind of asking myself, what's happened along the way? Why do we lose our ability to have compassion for maybe the same folks, who are repeatedly returning to difficult circumstances, or maybe sabotaging your all the efforts you make? And, what is it like to work with, complex cases? What is it like to hear the same stories over and over again? And, that might be the case for you if you're a settlement worker and you've worked with a particular population. It might be that at some point you are a little bit more numb. And I don't know if you've noticed that in yourself, that, maybe the first few hundreds of cases you dealt with, you were really in there, and maybe you were too far in there. Maybe at the beginning you wanted to take everybody home for Thanksgiving and you wanted to adopt every child. And, that's certainly something that is a not normal kind of outcome. But at some point, those of you who have more experience, I wonder whether you noticed that you weren't quite as affected by it. And I'm actually going to give you a very relevant example of that. Over the weekend, I went with my partner and a friend to watch a movie that won the Cannes Film Festival last year that some of you maybe have seen, and it's called I, Daniel Blake. And it's a movie it's a wonderful, really gritty film about a man who lives in Newcastle in the north of England, and he loses his job due to a health issue. And the movie is really about him navigating and kind of failing to get the resources he deserves, and at some point, it all catches up to him. It's a very troubling movie, not a lot of trauma content, but, the story is very devastating. And my partner, who's not in this field at all, spent the entire movie being really moved. And at some point I had to tell him, he had to tone it down because he was too loud, he was sighing and he was really upset, and we're in a movie theater. And my friend on my left, who's a teacher, she was the same. And I felt really nothing. And I didn't feel nothing because I'm not a caring person. I felt kind of nothing because there was nothing new in that story for me. And we had a conversation about that after, and we were talking about, what is it like to work in a field where you're exposed to pain and suffering every day? And what I said to them about the movie is I said, this is my job. I do this every day. It doesn't mean I don't have compassion, but I have to find a way to shut it off to some degree and find the, kind of the perfect level of empathy. And by the way, that's a quest we're all on all the time. What is the right amount of caring, and how do we figure that out? So that's kind of in a nutshell, kind of the history of what got me interested in this. Is I was concerned about re-victimization and profiling. I was concerned about the erosion of quality of care that I was noticing in courtrooms and in hospitals and other places, and I wanted to kind of explore what are ways for us to develop and retain compassion for others. Now, interestingly, it depends how I react to things such as the movie. Sometimes when I'm in the red zone and I'm really quite compromised, that movie might have absolutely devastated me, and maybe I wouldn't even have gone to watch it because maybe it's not such a good idea to watch a movie like that when you're actually in the field all day. But, I'm in a really good place today and this week and this month, and it was actually a perfectly fine thing to go see. But I kind of use that as a measure sometimes of how I'm doing. So to address some of these issues, I wrote a book in 2008 and was published again in 2012 called the Compassion Fatigue Workbook. And in it, I interview service providers of all kinds who talk about, what is the cost of caring? What is the impact on them? And one of the things that we started finding in the research is that the first casualty, when we burn out, the first casualty is usually loss of compassion for ourselves. A lot of us still do a really good job. In fact, on the job, we continue to have compassion, at some point for our colleagues. That starts to go at some point. But the first places we notice it are in our personal realm. So loss of compassion for ourselves, and definitely loss of compassion for people at home. I don't know if you have loved ones, waiting for you when you get back from the field, but I have certainly had situations where I would go home and someone at home had a quote unquote, crisis, and it so paled in comparison to what I had seen during the day that I just had nothing left for them. In my book, I interview a nurse actually who works in a very busy clinic in Toronto, and she talks about taking her teenage daughter to work for a job shadowing day, and at the end of the day they go back home and they have dinner, and her daughter says, she says to her daughter, what did you think about my job and the day? And her daughter says, you know, without even hesitating, she says to her mom, I found out something really interesting today. I found out that you're a heck of a lot nicer at work than you are at home. And that really landed for me, and I started exploring what are ways that we can improve, you know, kind of our working situations without necessarily having power to eradicate poverty and oppression. And, you know, what do we do when we work in a really tough place and we don't have a lot of control? As I mentioned earlier, I live in Kingston, Ontario, and as many of you know, Kingston is the prison capital of Canada, so we have a ton of prisons, halfway houses, and so on. Big correctional industry here. And I often am called in to work in the maximum security or medium security penitentiaries, and a lot of places like that, you know, are really quite toxic. And I talk to prison guards and you know, all sorts of other people who work in corrections about ways that they can actually improve their health and their well-being while remaining in that field. And sometimes it's possible and sometimes it's not. And I think the other piece that's important to remember is that sometimes this isn't the right job for us anymore. And I certainly shifted out after 7 years of working as a crisis worker. I shifted and I went to do something else because that volume of work was no longer suitable, and I don't think that I was able to provide the best service I could. And I think I encourage a lot of career mobility in our fields, that sometimes we don't all have to quit and become, you know, bakers. It seems to be the big fantasy among all the folks I talk about. They say, I'm just going to leave and make cakes or something, run a coffee shop. Sometimes we do need to leave, and other times we can stay, but sometimes it's time to shift to doing something a little bit different. Tend Academy is our company, and we are a team of 8 consultants and specialists in crisis trauma, mental health, and organizational health. My co-executive director is Dr. Pat Fisher. Pat is a clinical psychologist with over 30 years of experience doing trauma work of various kinds, and she's an expert in organizational health. So what she is called in to do is often their workplaces, I have examples, I just got 3 different emails yesterday from workplaces that are experiencing a lot of challenges, you know, limited resources, high stress, high trauma climate, and folks are starting to show wear and tear. And Pat has developed a whole bunch of resources, such as this book called Building Resilient Teams, this wonderful new book called Resilience, Balance, and Meaning. And what we do is we go and perform kind of assessments of what's going on in the workplace, and then we make a whole bunch of recommendations. And if you're interested in knowing more about our work, I just invite you to go to Tend Academy, which is our website. So in the work that we do, we travel across North America. We have very heavy travel schedules. I just stopped my big traveling season, but it was you know, really from September until now. And we visit and work with lots of different workplaces, whether it's with the criminal justice system, with the, all sorts of NGOs of all kinds. And the thing that we started noticing, which is really quite fascinating and why I'm sharing that with you, is that what we're noticing in every workplace is that there isn't actually a huge amount of variability between the places, the kind of the stress effects and the complaints that people are experiencing. Even if I'm working in the Yukon and I'm in Hawaii the following week, and then the week after I'm in, you know, Barrie, Ontario, and Brantford, it doesn't really matter. We're hearing the same story over and over again. We're hearing stories of diminished resources. I'm sure that that's your case as well. I doubt that many of you have more funding than you know what to do with, and I doubt that many of you have more funding than you had the year before. So we're seeing people who are experiencing a lot of overload, work overload, role overload, and we're also seeing, without going into too much of a divergent conversation about politics, but what we're seeing recently, as you know, I'm sure, is a really significant stress effect caused by the political climate. So the reason I was called in to work with the Refugee Board a few years ago was because of the new rules that have been implemented by the Harper government, you know, as you know, about, you know, tighter timelines and, you know, higher volume of work and going through more cases faster and so on. And that was causing a tremendous amount of stress and also moral distress to the staff. So we're noticing that more and more, and certainly the American folks that we're working with right now who are experiencing and demonstrating all of those. And on top of that, when we are very stressed, if you think about things in your personal life, when we're very stressed and there's not a lot, you know, kind of a wiggle room, we are also more reactive to things that happen around us. So an example I can give you is on Friday I had a phone call from a Los Angeles-based children's mental health unit where the staff have become extremely safety conscious. They want, bulletproof glass and they want an armed guard, but this in no way is actually an accurate reflection of anything that has happened in their neighborhood or even in their clinics of any kind. It's a multi-site agency, and not a single part of that agency has been affected by violence in any way. But of course, they're being profoundly affected by what they're watching in the news. So it's a complicated kind of climate, and I think that you can probably agree with that. And what I am really interested in doing is unpacking what of those elements are we able to control, and how do we figure out this job so that we can be in there for the long haul. So I'll just tell you before I keep going that I'm irritatingly positive and optimistic and I'm interested in solutions and problem solving, and I have managed to stay in the field of trauma and crisis work for over 22 years, and I plan on staying in this field until I retire at age 85. So I want to propose to you some solutions that we have found to be really helpful. So 2015 was basically the 25th anniversary of the birth of the field of compassion fatigue and kind of the whole research on secondary trauma and burnout. And it really began in the early 90s, and in the interest of time, I'm not going to spend a lot of time on this, but sorry, I'm just going to take a sip of water. But basically, some clinicians in Florida and Connecticut in particular became really interested in witnessing signs of stress effects in the staff that they were working with. And the folks that they studied at first, and they published a whole bunch of books on this topic, such as these, and the folks that they were really primarily studying in the late 80s, early 90s were nurses working in pediatric oncology. So you can understand that working with children with cancer was very challenging work. There was a very high mortality rate in those years. It luckily has diminished now. Anyone working in child protection and child welfare. And they also started noticing that folks working in the animal care community were experiencing quite a significant amount of symptoms that looked like certain features of post-traumatic stress disorder, even though it was not the entire clinical overlay. And so folks like Dr. Charles Figley, based at the time in Tallahassee, Florida, himself having worked with Vietnam veterans and other victims of sexual trauma and other things like that, Charles became really interested in doing more research on this topic, and we are now 25 years on. We've done quite a lot of work on, what does this look like and how can we help? So in the first kind of decade or 15 years of the field, we needed to convince the world that this was even a thing. And as you probably know, that is still a challenge to this day. Some organizations contact us and say, this is a huge issue. It's priority number one to take care of the health and wellness of our staff. Other places still have to be convinced. I worked in in California a few years ago, and the judge that was the decision maker for the funding was a former death penalty judge, which, if you can wrap your head around that job, wow. And he was now working in dependency services. So these are children who've been in foster care who are going to court. And his first comment about our request for funding for this was, this is a self-indulgent topic, he said. I don't think this, he saw this as superfluous and a luxury, and he wasn't being a jerk, he just didn't know. And so what I did is I collated some of the most recent research on, what is it like to be impaired and to have your ability to make decisions and deliver services, and how does that affect the bottom line? And he actually became our biggest fan. So we're still out there, having to convince some folks that this is even a thing. I was recently helping someone in San Antonio, Texas, put together a grant application to help refugees in that community, and the grant was denied as being frivolous. So, we have a ways to go still. But we know the data's in, and we know that this is a thing and it has an impact on folks. And what we needed to do now is do some research on what works, and that's what I want to quickly offer to you. So what we've designed, so I belong to a secondary traumatic stress consortium, and we meet on a regular basis. These are really thought leaders in the field. We have academics, we have policy folks, we have trainers, we have clinicians, and we get together regularly and kind of talk about what works. And I want to offer you this kind of current iteration of how we visualize this, and I'm going to go through it a little bit and kind of explain what this is. So what we started realizing after spending quite a bit of time talking and doing research, and I've met over 100,000 folks who are in the field, and we started realizing that it wasn't so cut and dried, and there wasn't just this one thing called compassion fatigue. And we also realized that compassion fatigue wasn't a term that resonated with everyone. And so we've kind of been working on this kind of concept. So if you don't mind going through this for a minute, the way, and when I do longer workshops, we spend a lot more time on this, but the way to think about this is basically the following. The more exposure you have, the more risk you run to end up in trouble, whether you want to call that burnout or you want to call that what have you. But basically the first piece is your own stuff. What are your personal vulnerabilities? What is your coping style? Why did you go into this field? Were you attracted to this field for personal reasons? Maybe you were yourself someone who went through the system. Maybe you yourself were someone who was a refugee at some point in your life. I certainly know that I recently did a course with child and youth workers, and a very large percentage of people who go into the program to become child and youth workers were themselves wards of the state, and they were in foster care. I don't think that's strange at all. I think it makes a lot of sense. It just highlights, on the one hand, a set of strengths that you may have that can be value added and make you really good at what you do. On the flip side, those are potentially vulnerability factors that you need to be aware of. Do you have someone to talk to when you go home? When you go home, do you exercise or do you drink a 40 of vodka? Those are all things that we need to kind of reflect on in terms of what are we bringing to the table. And, as someone who's now, in my fourth decade, I also became very humble about the truth that, we're all flawed individuals, and the less, we pretend that we're all fine and we've got it all figured out, maybe the easier it is. And so for me and for my friends, when we need help, we get help, and we get more training, we get more training. And I feel like in this decade, I've become a lot less defensive and arrogant maybe about the fact that I'm a deeply flawed individual and I'm good at this job, but I also sometimes need to check in and see whether I'm really at my best place. And I'm very comfortable with that, and I feel like we have a lot of stigma and taboo to work through with that too. The second piece we encourage people to think about is traumatic grief and loss in the workplace. So has a case that you were really invested in, gone terribly wrong, or has something happened that hitched a ride with you? I have a younger sister who has her master's in social work, and one of her placements was in a detention center in Montreal, and she found that a refugee detention center, and she found that extremely challenging. And of course, some stories, hitched a ride with her, and we talked about that and how do you deal with those losses. Another way to think about traumatic grief and loss is losses in the workplace of your colleagues. A beloved colleague leaves or passes away, or you lose a beloved supervisor. Those are kind of different types of losses you may experience. Direct exposure is something that some of you are exposed to more than others. It's about being directly exposed to violence, poverty, adversity, abuse. So a concrete example of that, I'm sure all of you would agree that first responders have a lot of direct trauma exposure. So would child protection workers who do apprehensions. So some of us have less of this. Some of us are more exposed to secondary trauma, but we need to factor that in. Are you working in dangerous neighborhoods? Are you exposed to, concrete things? If you work in a refugee camp, for example, you may be exposed to more direct exposure than other folks in the field. Then we talk about indirect trauma, and indirect trauma refers to compassion fatigue, It's been a long weekend, right? No, it's not a long weekend. Anyways, it feels like I just came off a long weekend. My brain's not working. Indirect trauma is secondary trauma or vicarious trauma. We call them interchangeably, these two terms. And it refers to trauma that you did not experience, but that you have been exposed to through sharing. So folks who are sharing their stories with you, through the news and the media, through colleagues debriefing with you, to cases if you go to hearings, to reading difficult cases, if you're reading victims of torture's accounts. Those are all secondary forms of exposure. And a lot of us are exposed to quite a lot of extraneous material. And I think that sometimes we've become so desensitized to that information that we forget that maybe not everything is appropriate to share all the time. I was recently at a very large child abuse conference in Alabama, and most people who are presenting there are forensic child abuse investigators. And they would often start their workshop, which was on strategies and tools to investigate these things. They would often start their workshop with a 13-minute video of a child being abused, which is completely unnecessary, inappropriate, and re-traumatizing. And when we talked to them about that, they had really never thought about it because they thought, well, we see this every day. We are desensitized. And the truth is, and that's for a longer conversation, that these things have a cumulative effect, even if you think you're immune. So what I encourage you to do is to think about what are all the ways in which you are being exposed to extra trauma material that isn't within the day-to-day interactions with the folks that you serve. Obviously, we don't want to silence people who are, sharing their life experiences with us, but I invite you to think about in the rest of your day-to-day life, are there ways in which you can reduce that? Do you do this job and then go home like my friend who's a parole officer and watches 6 hours of CSI on Netflix? Well, she's basically doing the same thing again. She's re-exposing herself to the same kind of stuff. Compassion fatigue refers to the profound erosion of your empathy. And the example I always give, to give a really quick example of what is compassion fatigue, is the following. And I often ask even high school kids about this, have you ever had a friend who went through the world's longest ever breakup? And in the first few weeks, you were there for them. You were like, call me anytime. Let's go out for drinks. I got you. When did that shift for you? When did it change to feeling like, oh my goodness, I don't have anything in me. I have nothing left. And that's when our compassion starts eroding. In our workplace, and I'm sure some of you have experienced this, have you ever worked incredibly hard with one of the folks that you serve? You found them housing and a job and you support, everything, and they absolutely did not follow through, or maybe they even sabotaged what you had put in place. And maybe the first few times you were okay with that, but at some point you were done. And it's for a longer conversation, which we'll talk about in a minute, of why people sabotage, because I have a whole kind of perspective on that that's actually very compassionate. But if I feel like I'm working harder than my clients, I'm going to burn out because I'll have nothing left to give them, and I also won't have that pool to tap into. Another way to think about compassion fatigue is about repeated exposure to similar cases. So I talked about that a little bit briefly earlier, but at some point when I worked at the university as a crisis counselor for 7 years, I had seen so many similar stories. And on the one hand, that was good because it allowed me to be able to resource people very, very quickly. And I'm sure you've done that too. If you've been around for a while, kind of like they walk in, they're from this place, they have this issue, and you're already thinking to yourself, I'm going to phone Nancy, she owes me a favor, and you can case manage the crap out of something. But on the negative side, if you've been around for a long time, maybe you're no longer listening. Maybe we start profiling. I had my physical the other day, and I went to see my family doctor, and I agreed to see a resident so that she can get some training instead of my regular family doctor. And she was a lovely person, but it was really interesting how much profiling she did. Now, the profiling that she did was, of course, the white woman of privilege profiling. So she assumed because I am a white woman and I'm educated and I'm articulate, blah, 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 that she made so many assumptions, and she asked me all these closed-ended questions, and I thought it was so fascinating that she did that. So one of the things that she said, and it was just interesting. So we're doing the whole thing, and she's never met me before, and she looks at me and she goes, you don't smoke, obviously, you don't look like a smoker. And I actually don't smoke, but I just thought it was so interesting because I thought, wow, what an interesting assumptions you just made. So sometimes we also get compassion fatigue because we've just seen too many people who are the same, and we start making assumptions about them. The next one is systems failure, which is actually, to me, the biggest issue that I think we are struggling with. I think that a lot of us, yes, have trauma exposure of various kinds. Yes, some of us have a personal history. Yes, there's an erosion of our ability to care. But I think what we're seeing more and more, and that's what I was describing, what I'm seeing in the States with folks who work with refugee claimants, for example, is profound moral distress. And moral distress is a term, if you're not familiar with it, that comes from the field of medical ethics. And in medical ethics, as you know, every hospital has a medical ethicist on call that you can contact when the hospital has some big life and death decisions to make, who should get this transplant, who should get this very expensive life-saving medication, who should be taken off life support, et cetera, et cetera. And we know that medical ethicists help people navigate through those decisions. Moral distress occurs when policies, rules, regulations, procedures, laws, whatever, interfere or conflict, rather, with your belief about what is ethical, morally right, and simply the right thing to do. I am sure that if we were having a dialogue right now, and in fact, I invite you to share some of those when we have a conversation. I am sure that all of you have at some point experienced moral distress in your job. And what happens, and there's a very scientific term for it, the way to know that you're experiencing moral distress is when there's a rule, regulation, procedure, or law that makes you angry and your reaction is, this is bullshit. This rule is bullshit. And we know that when that occurs once in a while, it's okay, but if it's happening a lot, how do you feel about that? And how do you go home at night when the system is actually re-victimizing the folks that you work so hard to help? And I've collected now thousands of stories and examples of moral distress, and I'm sure you would have your own. But really quickly, a couple of examples in other fields that I hear all the time are early discharge to nothing. So someone is maybe prematurely discharged from the hospital because they have no room for them, or aging out of the system. All of a sudden you turn 19 and all of a sudden you're no longer a ward of state and you're off on the street. So that's something that if you're kind of looking for one place to dig in, it's one place that I recommend that we spend some time kind of talking and to each other and thinking about, how do I navigate the system when it's so deeply broken? If you're looking for a wonderful, extraordinary book to explore this, I would recommend my colleague Laura Van de Lipsky's book, Trauma Stewardship. Trauma Stewardship is the book. Laura also has a TED Talk, and she talks a lot about that. And in fact, she interviewed a couple of leaders of displaced persons, I think, in refugee camps, and she interviewed them, and they talked about that. And there's some wonderful sections in that book. Well, the whole book is wonderful, actually. The final one is burnout. And the way to think about burnout is related to your occupational stress. So it's got to do with your working conditions, your hours, your pay, your rewards, your recognition, and who you immediately report to. What we have found in the research is that who you immediately report to means a lot more to your workplace happiness than where you work. So the way that I use this when I do longer workshops is I invite people to kind of look through this Venn diagram and think about, how would you fill this out? Would you have all of these right now? Or would you have some but not others? What I started finding after 7 years at Queen's University doing crisis work, and I was also working with the Canadian Forces Member Assistance Program with soldiers who were coming back from war zones and doing couples counseling and so on, is that of course I had a lot of indirect trauma exposure. Of course I did. But what I experienced the most, my biggest stress effect, and of course I had some burnout because my working conditions at the university were not great. We didn't get paid very well, and the volume of work was incredible. But the reason I left the university was actually related to moral distress. I profoundly disagreed with some of the regulations and policies about the way that I could treat and serve the folks I work with. And I then left and went full-time in private practice, and the bulk of my work was with soldiers who had experienced trauma, and I absolutely loved my work. So it wasn't the trauma, it was the working conditions and the system failures that were the biggest issue for me. So if you remember nothing else from this webinar, I invite you to capture this image and kind of start thinking for yourself, where is it that you're actually finding the biggest elements right now? What's affecting you, and what can you do about it? And if you want to know more about that, we can talk about it later. So is self-care enough? So in the first about 15 years of the field, everyone said basically that you should, do yoga and breathe and eat spinach and everything was going to be great. Now, I'm not throwing out the baby with the bathwater. I actually am about to have a kale salad as soon as we're done. And I went to the gym this morning. I'm really good at that stuff and I believe in it. But what started happening is that a lot of workplaces and employees started realizing that it wasn't enough. And there was a study done in 2005 and 6 by Ted Bauber and Shel Rieger at the University of Toronto that confirmed this. What they basically did, and we don't have a lot of time, so I'm going to skip over a couple of things, but they basically did some research to find, does self-care actually reduce indirect or secondary trauma? And what they discovered is actually that it didn't. And what they also discovered is that believing in self-care does not actually mean that you do it any more often than anyone else. It just means that you say you do. And that we found, in fact, that engaging in self-care, although it's a really great idea, did not actually reduce people's trauma scores. What we found reduced people's trauma scores were their working conditions. So reducing trauma exposure is actually a really good way to reduce secondary trauma. Having, and I'll talk about a couple of other solutions in a minute. They also started finding that a lot of us were being blamed by our workplaces, that basically the message was, well, if you had better work-life balance, you wouldn't be so burnt out. Or, you know, workplaces who kind of do the double speak where they claim to be in favor of work-life balance or healthy, compassionate workplaces, but in fact their day-to-day behaviors do not actually fit that. And I'm encountering a lot of workplaces who are struggling with that. Now, don't get me wrong, the 99% of leadership that I meet are incredible, caring and really invested, but of course they're the ones who are getting in touch with us. But once in a while, I also go to workplaces that think that they can run a human service industry that's got trauma exposure and diminished resources by applying, you know, the Toyota model, which if you're not familiar with it, you can look it up, which is about running a better factory. And I just want to propose that maybe the model for running a better machine and factory isn't necessarily going to work for high-stress, trauma-exposed work environments. Carl Killian, a really dear friend of mine at York University at the time, did a follow-up study to TEDS, and he found, this is a really great paper, I recommend you read it if you're interested. He did a multi-method study of all of these factors, and Kyle has worked a lot with the victims of torture and a Center for Victims of Torture, and he did a study that found that the following factors were far more effective than simply self-care. They were organizational changes, so better working conditions, more control of our schedules, good supervision, and again, reduced trauma exposure. Now, don't get me wrong, I think self-care is crucial and it's essential in terms of being an ethical practitioner. I don't think that I could do a very good job if I was sleep deprived and hungover and, you know, struggling with physical symptoms all the time. Those things are my personal responsibility, but what we realize is we need more. So really kind of quickly what we found, and again, you know, if you're interested in more of this, you can come to our conference or go to our free website for all free resources we have. But what was found is a constructive and supportive team makes a big difference, but then think about it, one of the first things that goes by the wayside when we don't have enough resources is actually time to connect with each other. Regular rotation of heavy traumatic caseloads has been recommended, so not have one person in your unit be the expert on X, Y, and Z, but make sure that there's variety. And what works on a personal level is absolutely self-awareness. So we use this kind of model that some of you have seen in the military to kind of, you know, chart where they're at. And, you know, the green zone is when you're feeling really, really good, and the red zone is when you're really compromised. And I pay attention to that all the time. I call it the big three: physical warning sign, emotional warning sign, behavioral warning sign. So as I mentioned to you at the start, when I'm in the red zone, I'm not going to go see Daniel Blake at night because, first of all, that's a bad idea, and secondly, because I will have absolutely nothing left in my tank. In fact, if I'm in the red zone, I'll probably be in my pajamas by 5 o'clock in the afternoon, and I won't be going out at all. So the goal is to kind of make sure we don't get there, and the goal is to monitor what does the yellow zone look like for you, and how do you know that you've started to head for trouble. And what I encourage you to do is to first of all think about your body. What is your body letting you know? How do you know you're in trouble physically? What are your first warning signs? Every one of us has a favorite body part that tells us we're in trouble. We just tend to ignore it or we medicate it. Some of us get migraines. Some of us get neck and shoulder pain. Some of us grind our teeth. A lot of people get heartburn, palpitations or rashes, irritable bowel or urinary tract infections. These are all connected. And as we know, stress absolutely affects the immune system. And I have not met a single person so far with irritable bowel syndrome who has denied that stress has an impact on, you know, nutrition, of course, and genetics, and, you know, all other elements as well. But your body lets you know. The question is whether you pay attention to it or not. Behaviors in terms of, you know, how do you transition out of this job? Do you go home and watch 7 hours of Netflix? Do you shop? And, you know, there's different ways of shopping, and you know the difference between buying something because you need it and shopping, buying stuff you can't afford because it's a way to numb out. I found that really interesting in the military. In fact, a lot of soldiers who came back from the front lines, as you know probably, they get a pretty, well, not a great pay, but they get better pay when they're away and it's tax-free and all that kind of stuff. So they often come back to a big chunk of change. And a lot of soldiers who actually turned out to develop post-traumatic stress disorder would make large purchases they couldn't afford. So they would come back from the front line and buy a $60,000 pickup truck. And there are a lot of personal bankruptcies in the military, and I think there's some correlation there. It's very interesting. So maybe, obviously, you numb out with substances. That's very popular in all of our fields, and there's been some more and more research suggesting that women in their 30s, 40s, and 50s are abusing alcohol in ways never seen before. And there's actually a couple of really good books on this topic if you're interested. One of them is called Drink. That should be easy to remember. And there's some interesting kind of reflection on why are women taking those methods now to unwind, and it's actually turning into a problem. Now, maybe you don't drink or smoke or do drugs or do anything like that, but maybe you eat till you fall down. I've seen a lot of nurses who are actually obese, which is kind of a contradiction because obviously nurses are on their feet all day and they're having to do a lot of physical labor, but what they talk about is their shift work is very stressful and demanding, and what they often do is they will binge on sugar, salt, and fat in the middle of the night because it's a way to self-soothe. So these are all ways of numbing out and self-medicating, and I'm not judging them. I've probably done all of these things except the one that's illegal, obviously. But it's about monitoring for ourselves, why is that happening? Why am I watching 7 hours of Netflix? Kind of developing some self-awareness around that. So what works basically, because I don't have a lot of time, this is probably the most important part, and this is the part I spent quite a lot of time with the decision makers of the IRB, was encouraging them to become trauma informed. So all I'm going to do right now and talk about this is simply give you a TED Talk to watch. This will be your homework if you don't mind. If you haven't seen it before, there's a very powerful TED Talk by Nadine Burke-Harris, who's a pediatrician in San Francisco, who talks about the adverse childhood experiences studies. And if you're not familiar with this, in a nutshell, there's basically very irrefutable data now that proves that experiencing 4 or more childhood experiences that are abuse, neglect, or household dysfunction will lead to a lot of negative health outcomes and behaviors. This might, land and explain a whole bunch of things to you when maybe you're dealing with folks who've had unimaginable childhood trauma, maybe refugees or coming from war-torn countries, and they may exhibit all sorts of physical ailments that don't make sense, or maybe some of their decisions don't make sense. And what we invite folks to do is to become trauma informed so we can have a better understanding of why people behave the way they do. I want to conclude by focusing on, one of our favorite tools in our trainings, and we have an annual conference every June. I'll mention to it at the end, but a whole section of our conferences are always about resiliency. And resiliency means strengthening ourselves for when the going gets tough. So I don't know how you take care of yourself, but I know that in order to do the very challenging work that I do, I need a tremendous amount of sleep. I need exercise. I need to eat well, but I also need to learn grounding skills because there are times where I cannot prevent exposure. I might have to go and hear a graphic story of a forensic examiner. I work with child pornography investigators. Sometimes I am going to hear things. And what the research is showing is that grounding skills are tremendously helpful. So mindfulness, some of you are familiar with neurofeedback, or all sorts of grounding skills that are proven to be really, really effective in bringing us back to our optimal zone of comfort. So if you're interested in that, like I said, we're talking about it more at our conference, and there's a whole bunch of resources if you want to look up Pat Ogden's work as well. And there's a free app that was created by a friend of mine, Elaine Malik-Harris, who's in Los Angeles, who actually works in refugee camps. She was recently in Turkey, and what she was doing is teaching refugees themselves how to ground and take care of their own stress effects. It's just a really interesting field that I cannot do justice to right this minute. So I want to finish by inviting you to think about, what are the practices that are essential to your well-being? So this is mine. It can look like something completely different for you. I had to kind of map out, what do I need to do in order to be the most ethical, present, compassionate service provider? And these were mine. And so, that can look like something else for you. But for me, it obviously had to do with having, definitely being in as good a physical health as I can be. Simplifying might seem weird. People often ask me, why is it there? I don't know about you, but if I'm scrambling trying to find my children's snow pants and my income tax receipts and my house is a mess, I can't actually focus properly. So what I often do is, get rid of stuff, declutter. My house does not need to be real estate ready, but it's certainly helpful to have enough brain space and physical and emotional energy to deal with the day-to-day stuff that comes our way. So I'm going to finish by inviting you to think about, who's in your tribe and who's there to support you, and what are the choices that you can make, what's in your control. And this comes from Stephen Covey. What is within your control? What are the things that you can influence, and what are the things that you have no control over? Because at some point, you are not going to necessarily single-handedly fix, our broken system and our poverty and our racism and the wars. And so how do we stay afloat while doing that? So basically, this is just a slide concluding, saying all the things I already said. The last two things I want to say is if you're interested in more of this, there's a free article on our website called Beyond Kale and Pedicure. If you're having trouble finding it, you can email my assistant. I'll give you her address at the end. And the final thing I want to mention before we open it up for questions is that we have an annual conference. It's June 23rd. And you can check that out as well. And it's in Toronto this year, and it's a fantastic one-day look at this for service providers and managers as well. Wow, that was quick. So there we go. That was 45 minutes of my entire life's work. Let's take some questions if there are any out there.
Well, thank you very much, Françoise. That was great. So we look forward to your questions. Those of you in the audience, either type them in the question box or raise your hand if you'd prefer to speak. Okay, so far I just have a comment that it was a wonderful presentation.
Thank you.
And a couple of people are interested in the name of the TED Talk, so we can.
Yeah.
I know
let's go back to that.
Yeah.
So Nadine Burke-Harris, and I'm actually going to bring the slide up again. And there we go. Nadine Burke-Harris, and it's literally, if you just Google TED Talk Nadine Burke-Harris, it's the very first thing you'll see at the top. And Nadine is a pediatrician who talks about running a clinic in San Francisco in one of the lowest income communities there, and realizing that they needed to have a much more trauma-informed perspective to understand why their folks were not responding to treatment the way they expected. It tells it all in 16 minutes. It's just fantastic.
That's great. Thanks, Françoise. Are there any other questions? Oh, so what is the name of the conference in Toronto? You're back at that slide.
Oh, yeah. Yeah. It's called Care for You, and the website is there, cfconference.com. And we have 3 streams at the conference. So we have Learn, Connect, and Refuel. So obviously Learn, and I really invite you to go to the website and see the agenda. There are a lot of different presenters. One of them is this year is Dr. Alana Hirsch, who works and has worked in the past in the Lower East Side of Vancouver with drug addicts. And she's a physician, primary care physician, and she talks about how she has remained compassionate while working with some of the most, struggling folks in our communities. And we're going to have other speakers who are presenting all sorts of different perspectives. And then we have people who are presenting the refuel stream. So one of my associates, Dr. Diana Tikas, is going to present the grounding skills, and I did not spend a lot of time on that, but the whole perspective on resiliency and this window of tolerance framework and teaching folks to put themselves back in that place. It's an annual event. We might be going to Halifax next year, but normally it's in Toronto every June. So if you join our mailing list, you can be kind of informed of that if this year doesn't work for you. Anything else?
I don't see any. Okay, just a second.
Sure.
One just came in.
I'm in no rush though.
So the question is, as an employee, what would you suggest is the best way to navigate or approach your employer to discuss this issue?
What a great question. Yeah.
Yeah. And then just the second part is, unfortunately, some workplaces can have some hesitation in thinking that this discussion is leading to stress leave. So I'm curious to know what the best approach is.
We get that question all the time. In fact, one of the proposals I have to write today is a proposal where the HR department wanted the trainer to stop talking about this because they believed it was creating an epidemic. So a couple of things about that. In fact, the theme of our conference this year is the return on investment of investing in this issue, like why it actually makes smart business sense to invest in your staff. And in fact, if you're interested, if you go to our website under resources, we have a business case that gives you kind of the metrics of what is the cost of ignoring this, literally the dollar amount of not addressing stress in the workplace. I feel like if we take a step back for a second, I think we could all agree, first of all, that leaders are people too. Although, some of them we wonder, but, leaders are people too. And a lot of managers have been placed in managerial positions, often with a very short amount of training. And so managers themselves, and maybe some of you are on the call, will say, you know what, I was promoted and flung to the deep end of the pool, and then I had to swim. I have very limited resources. And so what we're noticing is, first of all, a lot of folks in middle management are themselves experiencing a lot of stress effects, are themselves dealing with diminished resources. And the idea that we're going to start talking about this terrifies them, because they think we are going to see an epidemic of people lining up saying that they have this thing, and now it's going to be a nightmare. And what I actually want to propose to you, other than using a business case, as I said before, is I want to propose to you what we successfully, all of us, have managed to convince the paramedic field in Ontario. This epidemic is already happening. It just has a different look and feel to it. It doesn't have that name. We're not going to make people go on stress leave because all of a sudden they realize this, because they're already on stress leave, but they've been diagnosed with anxiety or depression. And the problem is that before it was actually labeled and addressed, you would actually leave on stress leave, you would go out, with depression, and maybe your depression would be treated, but the actual contributing factors, which were maybe your work climate, were not addressed, you were sometimes not even asked about, do you work in a high trauma, high stress work environments? And so you would go right back into the trenches, and then eventually people would erode and fall apart. As you probably know, about 3 years ago, we had a terrible crisis on our hands. We had 16 suicides of first responders in Ontario in 14 weeks, something like that. Don't quote me on that, but approximately. And finally, paramedics and other first responders finally went to the Minister of Labour and said, this is an occupational emergency. We need proper compensation and support around this issue. And as some of you know, it is now law. As of April, the Minister of Labour was incredibly supportive of making this a recognized issue. I'm not suggesting, by the way, that all of us are at risk of developing post-traumatic stress disorder. I'm suggesting that a lot of us are at risk of experiencing stress effects, and that, of course, in turn can turn into something more severe. But I absolutely do not believe that talking about this leads people to feeling things that they weren't already feeling. You're just putting a name to it. And so, it's reminding me of a workplace I went to a couple of years ago, somewhere in Canada. I won't say where it is, but it was a very large group of Crown prosecutors. And the manager said to me, this isn't needed. My staff are fine. I don't have anyone on sick leave. It didn't matter that everyone was going to work compromised and maybe, under the influence and fighting and making, legal decisions and mistakes, but the fact that they were all bums on seat. The metrics look good. And I hope I don't sound too cynical. I really don't. I work with leadership all the time. But what we need to do is we need to find a way to address their fears and get them to also assess their own kind of levels of stress and depletion, and educate them that we are not bringing a new factor in. This is already happening. We are just putting a framework around it. Does that make sense?
Yes, thank you. Thank you for that, Françoise. I do have another question here. It says, what do you recommend for newcomers to the social services field who don't know how to pace themselves with workload?
Oh, that's such a nice question.
Mm-hmm.
I have several things I would recommend. First of all, and I'm really not trying to be cheesy here and say buy my book, but I would recommend that you read my book, the Compassion Fatigue Workbook, because I think that there's a lot in there, that kind of a lot of interviews and reflections of individuals who've been in the field for a while, and kind of a lessons learned. I think that what's hard, and I love that term, the person said pacing ourselves. I think that it's inevitable that when we start out, that we are, full on, and that we are impacted by these stories, and that we are, feeling the need. I'll give you an example. So when my sister finished her master's of social work, she got a job up in the high Arctic, where I'm from actually, and worked in a crisis clinic. And the very first week that she arrived, one of her client, 14-year-old, ended their life, and it was the third person in that family, one of those terrible epidemic affecting our First Nations communities. And my sister, who's incredibly grounded and smart and, went in there eyes wide open, we had a chat the week after, and she said to me, I realized that I was running between appointments, like running in the office. And she said, as if somehow if I ran fast enough, I could eradicate 300 years of cultural genocide. And she said, I realize I am no good to anyone if I burn out in 6 months. And this is the, $1,000 question about how do we figure out to navigate this piece. And what I'm going to say to a brand new person is, we're all going to make mistakes. And we're all going to go to the red zone at some point, or maybe several times in our career. But what I encourage you to do is really, and this is why I think my book is really good, because it really gets you to think about your yellow zone, your warning signs, so that you can catch it early before you are absolutely done. And I think that talk to mentors in the community or in your field. All of them, if they're honest for a minute, will say, you know what, 2, 3, 4, 5 times in my career, I came close to the edge of feeling not well. Maybe I didn't get to the full clinical, stress leave piece, but all of us, it ebbs and flows. And so what I would say is self-awareness, monitor what's going on, have a life. If you work in this field, please do not volunteer, at the women's shelter at night. Like, that is not a hobby. We need to find a way. But what I want to add to that is sometimes that can feel really difficult. And I'm sure some of you have sometimes felt like you did this job and then maybe you went out to a Christmas party or whatever, barbecue, and you felt almost gross. Like, you're like, how can everyone be having this, futile, frivolous fun when these people are suffering? And I'll tell you something. My soldiers who come back from Afghanistan and Rwanda said exactly the same thing. Those are reentry problems, they're reentry challenges, and we need to find a balance. That's a short answer to a very great, complicated question.
Thank you, Françoise. We do have someone who would like to speak, to ask a question.
Great.
Yes, so Lubna, I saw your hand and I'm going to unmute you. Please go ahead. You can ask your question. Lubna, are you there? Okay, you're unmuted, but we can't hear you, so it might be... Okay, it's already covered. Okay, thank you. It's already answered, she said. Thanks, Lubna.
Okay, is there a final question before we wrap up? No, I guess just another comment. Françoise, thank you very much. Someone who really appreciates the great information.
My pleasure.
Yeah, so thank you. Oh, go ahead.
No, go ahead, Sarah.
Thank you, Françoise. This was really informative. And I know many people in our own office were interested in sitting in and listening to this topic. So that's great that you made the time and shared your knowledge and wisdom with us. And thank you, everyone, for attending today's webinar. If you have any other questions or comments, maybe after we wrap up this webinar, feel free to contact Lorraine or I at refugeesettlement@ocasi.org. That's one word, refugeesettlement@ocasi.org. And once you leave today's webinar, you'll receive a survey of about this webinar. And we would really appreciate it if you could take a couple of minutes to complete that, to provide your feedback, because it's really important to us. And you'll, in the same follow-up email, you will receive a link to the recording, including Françoise's slides. And if you're interested in joining other webinars in this series of best practices, our next one is coming up on June 8th. There'll be a link on that as well. The topic is working with refugees in remote and rural areas. So on behalf of OCASI and Françoise, thank you so much for joining us today, and we hope you have a great day. Thank you.
Goodbye.
Bye-bye.